would encourage men to take some ownership in their treatment and in their disease. I talked to a lot of men, and they said, well, I don't really know when I was diagnosed. Ask my wife, she handles all that. So I don't think as men that it's fair for us to throw all the treatment responsibility onto our spouses, because it's a very difficult time for everybody. And the more you can assume responsibility-wise as the patient, the less you have to dish off on your caregivers. And it's going to be a long slog. It's hard on everybody. And the more of it you can shoulder yourself, more good you're doing for the rest of your family. There are so many women on these esophageal cancer sites talking about their husbands. Well, the husbands should be on there. The more that the husbands can do to get involved and engaged in their whole care plan, the easier it's going to be for them. And I don't know. It's important to me. And I know there are no stats to this effect, but the guys that I know that have been pretty successful in terms of survivorship, I think a larger percentage of those people are people who took ownership in their own treatment plan. And the second piece of advice would be to try and find humor in little things. My feeding tube fell out once when I was playing golf, and I called the doctor and I said, Doc, my feeding tube fell out. And I said, what do I do? And he said, what hole are you on? I said, I'm on the 7th hole. He said, well, wait till you get to the turn and wash it off with soap and water and slide it back in. So I said, okay. And he said, what are you using? I said, what do you mean, what am I using? He said, how far out are you? I said, I'm 140 yards out. He said, hit a 7-iron. Anyway, my point is, we ended up having this great funny talk as a result of the fact that my feeding tube fell out on the ground. And when I got to the turn, I washed it, slid it back in, never had another problem, but it's always stuck in my head as just one of those funny cancer experiences.